I'm Priscilla, and I'm the nurse caring for Mr. Jones. I'm prepared to give report off to the upcoming nurse. Mr. Jones was admitted 24 hours ago to the medical surgical floor. Chief complaint, right side heart failure. Situation, Mr. Jones is a 64-year-old male, and his reason for chief complaint was chest pain that occurred last night, and admitted diagnosis was complications of right side heart failure. Some background on Mr. Jones. He has history of hypertension for 40 years, and he has heart failure diagnosis for 30 years. His current active medications are nitroglycerin. He's been getting every Q4 hours for increased blood pressure, and morphine sulfate IV push for pain management. My assessment, Mr. Jones has no known allergies. He has an IV site that has been assessed, and it's to the right forearm. It's a 20 gauge. There's no redness, no swelling. Site is dry and intact. His last vitals, BP was 96/54. His heart rate is 62 beats per minute. Respirations at 22, and his SpO2 saturation is 94%, and he is holding that at 5 liters nasal cannula. His temperature is 37.1 Celsius. My assessments of his radial pulse was 64 beats per minute. His last EKG showed sinus bradycardia. His heart rate was at 58. Physical assessment. I assessed his head and neck. No obvious airway obstructions. Chest moving normally on both sides. Lungs were clear, equal bilaterally. Skin is normal with elasticity. Heart is regular without any murmurs. And abdominals are normal bowel sounds. And also he has a strong pedal pulse at 60 beats per minute. His carotid pulses were also 60 beats per minute. His capillary refill is less than 3 seconds. Patient shared in assessment post 1 hour given morphine IV push for pain, that his chest pain was at 2 on a numerical scale. Mr. Jones has been very anxious, expressing a desire to go home, and also in addition to his anxiousness, we want to monitor him for any further anxiousness, because he is eager to go home, which will be in post 3 days. My recommendations for this patient is to continue to assess for any shortness of breath, dyspnea, exertion during every shift. Nurse is to perform a comprehensive cardiopulmonary assessment encompassing heart sounds, lung sounds, pulses, edema during shift. We need to know if there are any abnormalities, signs and symptoms, of fluid overload that need to be monitored, edema, any new murmurs or other changes as they can present without patient feeling any symptoms. Monitor of lab values is necessary, and follow-up of physicians as ordered during Q shift. Also ensure that the patient is supported emotionally during shift, because the patient is adhering to treatment plans, but though again he has been expressing that he's very anxious and wanting to go home. So continue to support patient overall in adhering to pain medications and treatments to improve overall quality of health. Thank you.